Welcome to Glow and Tell.
I'm so excited that we actually have Dr. Kevin Mosca with us today.
Yes.
He is located here in Boca, and he is absolutely the best when it comes to body contouring.
Thank you.
Yes, he is.
Of course,
you.
I mean, you came so highly recommended. When reps refer, I listen. So you've been one of the most referred plastic surgeons.
So excited to have you on. Thank you for coming.
I really appreciate you guys bringing me on, especially one of these first episodes. I'm so excited to be here.
Yes.
I look forward to doing podcasts. I love talking about plastic surgery and being real about it.
Yes, because a lot of it's fake with the AI and the
It
whole
is. It is.
Photoshop and all that
It's
stuff.
It's
So
so difficult.
it's hard to know what's real and what's not. So
Absolutely.
we have
I've
you in the
actually
flesh.
met you forever ago.
Yes.
It's been forever because I used to be a rep and I used to call in your practice.
Yes.
And where was it? Sunrise?
It was in Lauderhill Sunrise.
Love it.
Yes. You
Love
were the rep at that time and come in and see me, and we've both grown up a lot.
Aw,
We have.
you're big
Here
now.
We are, as
Yes.
grown-ups.
Fantastic.
I love it. That's awesome.
So you are in Boca.
I am.
Yes.
And you
And you have
specialize
your
in
own.
body.
Yeah, you have your own place.
I have my own place, Mosca Plastic Surgery. It's on Federal, and everybody kind of I grew up being known as Dr. Boca Raton here.
I know. I
So,
saw your. I'm
yeah.
like Dr.
Yeah,
Boca. I'm like, is that his name?
Yeah,
Every
before
time
I,
I use your name, she's like, "Is that Dr. Boca?"
Yeah.
Yeah.
I'm like, who?
it's funny because people don't actually know my name, but I took it back in the day when it was like the thing to name yourself after like the area. And
Right.
before I even had a house in Boca, I like took Dr. Boca Raton before I could. And it's really just taken off. It's become its own thing. And
Yep.
it's more so now used as like a portfolio, which I like it better. It's not just a Instagram growth kind of thing.
Absolutely. And you're definitely known in Boca, so I'm excited to get to it and talk about all things.
Thank you.
And I know people think of plastic surgery and they think everything. And I know there are specialties. I personally would not go to a plastic surgeon that would offer me to do a facelift, my nose done, and a tummy tuck all in one procedure. So,
Yeah, I think it's really become a world of specialties within a specialty. So, there's plastic and reconstructive surgery is what we're board certified in. I'm board certified in plastic and reconstructive surgery. But I pretty much focus just on cosmetic. And then within the cosmetic field, there are specialists, for rhinoplasty, noses, facial rejuvenation. And I mostly focus my practice on breast and body over the past 10 years.
Right. Okay.
so what has been the hottest?
Yeah. What's
procedure
the
that-
hottest thing for you?
I mean, the hottest thing right now is mommy makeovers. To be honest with you,
What does that
it's-
consist of for you?
It's a combination of surgeries. What has happened, I guess there's been a shift over the past 20 years where it was women, got a breast dog. It was a big deal. And it was like, oh my God, I got a breast dog. Well, those women now have grown up and have families.
Yes.
So
And
it's
kids.
Kids. So now it's
700
And it's like, oh, okay, cool. My tits are sagging.
exactly. Now
Yeah.
the breasts are sagging, so we got to lift them back up and we got to
Yes.
rejuvenate them. And the abdomen as well, the tummy. So they come to me and we do combinations of breast, abdominoplasty, lipo, contouring to give the torso, the breast, just that rejuvenated look.
And you do a good belly button.
Thank you. Yes, I think the belly button makes the tummy tuck.
100%.
100%.
I really
Yeah.
do. I concentrate on that.
You can tell right away. I'm like, up, they had it. But sometimes if you don't know, then that's when you know
That's
it's good.
the best. That's
when you
what
know.
it's about nowadays.
100%.
Kind of a lot like it's talked about in the face nowadays.
Yeah.
Is it's like keeping them guessing. It has to look natural. Well, the body's the same thing. You want it to look natural. Breasts, overall size is coming down. People are going for
I'm
the more
noticing that. more of a natural look.
ballerina breast, and
Yeah.
we're tightening things up, going a little smaller. Not everybody, but it is a thing.
But to your point, it's been like, we talked about it a little bit before the show, that the natural look. And
Yeah.
one of the biggest
making a
things
comeback.
that I've been hearing is, the breast implant removal, and they're replacing it with fat grafting or alloclay. We could touch on alloclay as well.
Sure.
But I personally have a patient right now that had fat graft into her BBL as well as the breast, and full of fat necrosis. So what has been your experience with that?
So let's talk about fat necrosis. So fat necrosis is where you're grafting the fat in and it doesn't survive. So it dies. And it becomes painful and cystic and hard. And now I am not one of the surgeons who does a lot of fat grafting to breast. In fact, I don't do it on anybody unless it's a little bit of a touch-up with micro nano fat. Because for this reason, when you fat graft the breast, you can. I understand women are coming in to take the implants out because they feel it can be toxic to their body and they don't want a foreign body in their body. I get it. So we take the implant out, but the false impression is that we're going to be able to recreate that implant look with fat, and you can't. What I tell women is, when you look at your breast, it is a fat lobule basically. So you already have fat. What if I add more fat? What is that going to do? When that fat takes and it becomes a living organism in that area, it's going to sag. So you're going to have a fatty breast. It's never going to have that augmented full cleavage. So I'm not a proponent of taking implants out and putting fat in, especially if you're going to do it in certain patients where you didn't remove the capsule. There's no blood supply within that capsule to keep the fat alive. And if you fat graft too much trying to achieve these results that it's augmented, the fat doesn't have a blood supply. It dies and you get fat necrosis.
I could see that. But also, what are then your thought on Alaclay, which is the cadaver fat?
Alaclay is an amazing product that actually just came out. I was one of the first people in the Palm Beach County to receive it. It's basically cadaver fat, but it's been denatured, decellularized, and sterilized. It can be grafted in, but along the same, precautions have to be taken. When I graft into the buttock region, as if I was doing a BBL, I use an ultrasound to make sure I'm in the right plane, because you can get the same problems as if you were grafting real fat. When you're grafting it, you don't want to put too much of it, because if you put cells next to each other that aren't alive, they're not going to survive. It needs that blood supply to survive.
In addition to how much product it requires, and it is
Exactly.
just as expensive. And, I went away for the training in Austin, and one of the things I know you and I spoke about, I think you were mentioning that you want to make sure that everybody that offers the product has ultrasound technology, because it is dangerous. And I know nurse practitioners are allowed to perform the procedures, but how many of us have ultrasound in the office? So
Correct. And ultrasound is becoming a thing in facial rejuvenation where they're grafting the fat. I noticed this. Again, I'm not the face guy, but it is something that is, I think, a nice precaution to take. In Florida, BBL got a bad rap, and they kind of made us use ultrasound, but it's been a fantastic modality to add to our repertoire, especially with doing a BBL, because it showed us exactly, not so much that we were in the danger zone, but actually what's the best zone to inject in to get the best round effect of the buttocks.
Yeah,
thank you, Kardashians, for
Thank you, Kardashians.
I know.
For the
We're
trend.
making it trend.
and it's so
But-
expensive.
Oh my
I
God,
know
some of
we
the girls in Miami look nuts.
Yeah.
I don't even know what they.
I
have
don't
in there.
even-
There's no way.
There's like a whole
bad.
family.
Did you guys see the meme where the guy's doing it in the condo with the light on, like in one of the?
Yeah.
Oh my God!
You don't know what's
They-
going on down
girls
there.
Walk around with a heartbeat pumping in their
It's
butt.
so bad. I'm
Yeah.
like, I can't.
Yeah, no.
Oof.
no.
It's
Be
a different-
careful.
Yeah, you have to
Buyer
be careful where
be
you go. Yeah.
Where you go. But what does it require? Like for somebody that, well, actually, let's not talk about myself. But, people that are, but there are
Personal consultation?
Personal consultation.
So you're saying you
with-
want a consult?
What I'm saying is, could we?
What do you
assess
think
me
about
real
this?
quick?
Yeah.
I would love to know, what are your thoughts on how much fat to have before considering that?
Yes, I pretty much specialize in the skinny BBL, so the more natural shape. I don't do really a large vixen. I usually want. It's not about how much, but it's where it is. If it's in a good area to harvest the fat, typically I want about 1,500 cc's, so like a cup and a half that I can use per side to give a change in
For
the.
to survive.
Yeah, you're gonna lose. You're gonna lose 30% of it. I mean, you really are. Now, there's been advances in it and modalities. I've been encouraging hyperbaric treatments, which is like where you take in atmospheric pressure, pressurized
yes, heard
oxygen.
about that.
It's fantastic.
Oxygenation, yeah.
Yep.
So that's actually really helped keep the fat alive, survival rate. Obviously I make patients stay off their butt for almost a month in the skinny BBLs
Oh
because
my God, that's hard.
it's hard.
to do.
It's hard. You have to stay on your stomach. You cannot lay on your side. You cannot sit
For
down.
how long?
1 month.
Wow.
I know.
I didn't realize that.
Yeah. Yeah, it's hard. It's
had-
a dedication. It's
That's-
one of the toughest procedures.
Yeah.
So you can't even like dry. Like that's
No,
wild.
no.
Now you just lay on your stomach.
Lay on your
work from
stomach.
home.
Kneel. Well, the working from
Kneel.
home really changed things. I mean, it helped.
It's a bit.
I'll be quiet.
But I do BBLs with hyaluronic acid or Radiesse, and I mix it with hyaluronic acid or Sculptra, whether it's for skin texture or for hip
Sure.
dips, but it doesn't last.
Yeah, and that's the
You know,
biggest
and I kind of
complaint.
step back from that and I refer those patients out to somebody like yourself because I feel like if you're going to spend that much money and it's going to last 6 months and like everybody
Exactly.
wants to
Wow,
have
6 months.
curves. And now that everybody's on GLPs, I feel like everybody's on GLPs right now.
Yes, everybody's on GLPs.
Everybody,
Everyone,
literally.
everyone is on them. But it causes skin laxity. It
Absolutely.
causes fat loss, collagen production decreases. So, you know, what do you do? Like a full body? I had a patient text me today asking about what would I do for saggy booty and try to volumize that, but I can't stitch it up. Like I can't cut pieces off. And
It's tough. I mean, there's no.
what do you do?
What happens is, what I tell people is, when you gain a bunch of weight, okay, and you're overweight, and then you lose it, it's like your skeleton is a solid structure, and you're a mass of wax that kind of just melted down.
Melted candle.
Melted candle effect. And it's very difficult with these patients. You have to take the consultation very step by step, explain it to them. You can't do all of this at once, number one. That's very
Right.
important. And they're going to trade their skin for scars. There is no way around that. So when they have a saggy butt, you have to lift the buttocks back up. And it's a scar that goes across the top of the buttocks, almost like a reverse abdominoplasty where we pull that down. And some patients, you know, I've had an uptick in this field, and I love it, honestly, because they're very happy patients for the most part. The scars do not bother them as much as some women who are coming in just for that nip tuck that really don't want to be showing that they had any surgery. I feel like it's like a badge of honor to the women who have lost significant amounts of weight. And I do many different tummy tucks, but we do a fleur-de-lis tummy tuck where they even get a scar that goes up and down. In addition to this, they just don't care because
You guys
they're
have
trading.
modalities like lasers to get rid of the
Yes.
scar tissue.
Yes. Yeah.
And
There's
I want
lasers.
to talk to you about tightening too, because I know that, you know, I've been doing a little bit of research before today, and some of the hottest topics right now that women are researching is obviously all natural before they go under the knife, which is whether it's skin tightening, whether it's lasers. So what do you recommend? Do you recommend starting with less invasive and then, or do you prefer, I mean, obviously as a surgeon, you're like, yeah, let's go.
Yeah, I want everybody to do surgery, so no, I don't know. But honestly, I do. I recommend people try and do non-surgical first if they can. I caution it, though, because there's certain areas that it's just not going to work. I mean, I've had women who have tried and spent tons of money on skin tightening lasers, and they come to me for the tummy tuck finally, because they really, it's like almost like, okay, I know I need it at this point. Like
It is a big surgery, though, right? Tummy tuck.
It's a
Or
big
not that bad?
surgery. It's a big surgery, and for whatever reason, I don't know why, but like women just are obsessed with that scar as opposed to like a breast lift scar. It's actually more scarring to do a breast lift than it is for one scar to go across the
Or
bottom for an
C-section, it's
abdominoplasty.
the same
I had
thing.
I had C-sections,
Yeah.
so I have it already.
we
So
both
might as well
have
just
two, yeah.
have a better one.
Yeah, but there's some like stigma about it, but
Yeah,
I do a
I
ton
see
of
what you're
tummy
saying.
I
tucks.
feel like it's more about the bell button. Like back to your bell button comment. I
It's-
feel
that's it.
like I've seen
That's all
bell
I'm
buttons
saying.
in different zip codes.
Yeah.
You know, from
Yeah, I mean,
Imagine it's like on your back.
I've seen
over
them.
here.
Yeah.
We have one over here.
Yeah,
I've seen them all.
I've seen
Yeah.
it, and I've had to try to fix
like
it.
try to like the indentation, the cavities, I mean, I've seen all kinds.
Yeah.
Or like the flat, and it just literally like painted on.
That's always one of the questions. And if they don't ask me at the consult, they will message me on Instagram and be like, "We didn't talk about the belly button." I'm like, "Don't worry, these are my belly buttons. You see them. This is what I do." Yeah, I mean, the abdominoplasty is it's necessary. Most of the time, if we're doing it, it's necessary. And to be honest with you, most of the women who come in to see me, they see my Instagram and they want the body contouring, they want the lipo etching and that six-pack kind of Pilates look. And I tell them,
Mine is the hip dip.
minus the hip dips. So everybody wants a lipo BBL. And then I read the history and it says 2 children, C-sections, blah, blah, blah. And it's like,
Which is
I have to
considered scar.
almost break their bubble that like you're really a tummy tuck candidate. And then but I explained it as plainly as I possibly can to explain them that you can't just lipo loose skin. It needs to be tightened because if you lipo it, that's where you get those not so good looking liposuctions where they're kind of shriveled up and you're like, what is going on with it? It looks
Looks like
like a
cottage
raisin, like
cheese.
a
Yeah,
prune. Yeah.
How did you like the lumpy
cottage cheese.
lumpies?
Yeah,
Lumpy
I've seen that, and I'm like, oh, it's not it.
What are your thoughts? I know it's been like such a hot topic of biostimulants and plastic surgery. I know it's more related to the face, and the conversation is, what do you do? Like as a plastic surgeon, you lift the face, and do you scrape the sculptra and radius from there, or is it not even?
Wait, that stays in there like that?
Well, it's collagen stimulant, so I mean,
The
not
threads I know are definitely in there.
the yeah. What
I
are
would
your
never-
thoughts on that? Too?
Yeah.
Yeah, I mean,
The threads is actually
from my colleagues, what I can hear is the threads are difficult. When you disrupt tissues, especially with, the hot topic is, are we doing a deep plane facelift or are we not doing a deep plane facelift? Did this person get a deep plane facelift or was it so-and-so? So what plane you work in and where that scar tissue was created make a difference, okay? So if you have filler that's supposed to be injected really deep, and it's adjacent to the bone, but you do a more superficial facelift and your results are good. That's what works for you, okay? It really shouldn't affect it as much because you're not in that deep scarred plane. But if you're trying to get and dissect in there, so it's really surgeon dependent. And those surgeons that are specialists in it and oh, I only do it this way kind of thing, they're the ones who should dictate like whether you try and dissolve it, biostimulate it, whatever you need to do to try and clear that area of the scar tissue as much as possible.
completely makes sense. But also, do you notice that your patient population is getting younger and younger? I remember when I got into the industry, I think it's been 15 years, it's been a hot minute.
Yeah.
And I remember going to like aesthetic events, and it would be women between 40 to 50, starting, the
Yes.
youngest would be 40 in the room.
Absolutely.
And then towards the end, my rep world, and even now, like having my own practice, I see 20-year-olds. I mean,
Yeah.
it's 19-year-old. I'm like, where'd you get the money for this?
It's well, I don't ask that. I say it's preventative at this point. Like,
OnlyFans.
why are you getting Botox in your 30s? Well, so I look like this in my 40s. That's what people are
That's
saying.
exactly it.
So they're preventative.
It's preventative. And I've met plenty of injectors and good ones, not so good ones, but I think if you do it tastefully and conservatively, but you understand the facial anatomy, you're actually doing them justice. I don't know about
I
in the
agree with
20s, but 30s for
I
sure.
have a lot of patients in their 20s. Actually.
Really?
And they want like full filler, right? Yeah.
Full facial balancing.
Wow.
Yeah.
I feel like the patients are so much more educated at younger age.
That's
I
the
don't
touch
have
of our
Social
hands
media.
nowadays. Social
like
media.
patient base. Like I
Yeah.
feel like my patients
Yes.
are more between.
They are.
I mean, I've done lips for 17-year-olds whose moms bring them in.
Really?
Yeah.
Wow.
So between, I would say the youngest patient so far I've had is 16.
Mine was 9 for highlights.
Oh,
And I'm like,
wow.
wow, you're letting your child bleach their hair at the same. Okay, whatever.
Perfect. Gorgeous.
Love that for you.
And but yeah, for me, I would say 16. But most
That's-
of my patients,
yeah, that
are
is
in
young,
their
though.
20s. I would say
That
in
is
their
young.
20s, 30s.
What's
It's
most
just-
of yours, would you say?
what-
Like, what
what
age
is-
bracket are you?
Again, I have mostly like the 30s to 40s to 50s range.
Yeah, that makes
40s.
sense.
I don't
so
get
you're
the
more
young
like
breast dogs.
after
Yeah,
children.
I get them after children because that's really my wheelhouse right now is kind of the
mommy makeover.
fixing the breast and tummies. I mean, I did get a lot of lipo BBLs in their 20s. My practice has transitioned a little bit since coming up to Boca, and I don't do those budget BBLs that are like down in Miami. So people
Feel ya.
really
Yeah.
sometimes have to learn
Yeah.
the price does
No,
matter.
100%.
And
Yeah.
it's hard to get the BBLs to come to me when I'm not charging, basement prices.
Exactly, what they're mixing in their
garage,
basement,
yeah.
they're mixing
Exactly.
it in the bathtub, and they're like, "Yeah, throw that shit in your ass, and you're
or
good."
The surgeons are not doing the surgery, which is even scarier. And that's
I
the
know, I've
problem.
heard that
is
too.
true.
That's
That
the
is
I've
problem.
heard that.
But I feel like we're aging in such incredible time where, the young patients are so educated. I feel
Yeah.
like they're going to be
Absolutely.
vampires.
Especially with like peptides and
With the
like all that
peptides world.
biohacking stuff. Like, yeah,
Yeah, because
people are just
I
aging
agree.
backwards.
No, the
all-
biohacking has really, really brought about amazing
Yeah.
aging process. I'm all
amazing.
In favor
as
of
a
that.
plastic surgeon, you see the difference.
Absolutely.
You
I feel
do?
like since
Do
I
you
introduced
recommend it? Yeah.
peptides in my practice, I mean, I personally am a huge believer in all the peptides, quality peptides, because
I
there's a
agree,
lot
I
of
agree.
you could
There's a lot of
order
stuff from
online.
China.
Yeah, they deliver
China.
China.
They deliver those amazing Chinese peptides. But do you feel like you notice the difference between the skin laxity? Well, I guess in the face I do a lot.
Yes.
But all over the
No, I mean,
as well.
I see amazing, a lot of times I can go in, again, same scenario. Women can have 2, 3 children, and I go in and they have amazing skin sometimes, and I can do their BBL or lipo. So yes, I mean, I have seen an uptick in the better quality of aging. I guess it's been over the past 2 decades that I've been in surgical field. It's definitely gotten better. And I think people with the knowledge at their fingertips now in social media, the word spreads wider and faster of what can help you age slower.
Yeah. That's amazing, though.
That is
Look at
amazing.
us, just aging backwards.
I feel
We're
like it's going to
trying.
be like
I know we are.
vampires,
I know.
This is going to be me at 75.
Yep.
I hope so.
I know the right people.
Yeah, you do. You do.
So do I.
They're
Love
located
that.
in Boca.
I know.
And you'll like give me a full body lift, like tied behind my neck.
Yeah, we'll hide it. Don't worry, we'll hide it.
I will have no scars.
I know. Duh.
Kind of like, you do what is that called?
The halo?
The halo. We'll have like my body tied.
I'll tie it to the halo. I'll tie it in with the extensions.
Perfect.
Extra thread.
We'll forever look like
I
this.
love it. Yeah.
So what is the like for you as far as procedures go? I mean, I know Marissa was wondering, we were having lunch earlier. What is the most expensive? How much is the most money women
Yeah.
spend?
What's the most money?
Oh.
Your most, who spent the most as a patient for you?
I mean, I can't disclose.
Not the person, but the
Tell us
amount.
the name, their social security number, address.
Like what somebody was
no.
like, they came in and they were like, you did your
Do it
consult
all.
and they were like, do everything. And you were like, all right, it's this amount. And they were like, fuck it, do it.
Yeah, I mean, it's getting up there to me to be able to charge anywhere between $40,000 and $50,000 for a mommy makeover that involves a lot of work is I think it's where it's getting to at this point.
Yeah.
Honestly, for quality work and taking time.
I agree.
These patients are typically my only case of the day, so
You'll be there all day.
it's
Yeah.
pretty much the same as if I did 2 patients' surgeries in a day, but it's pretty much, a 6-hour surgery, facility fees, everything goes up every year with inflation. So the cost of surgery has gone up immensely even since I started 10 years ago.
Do you have a surgery center or you go to the hospital?
No, we do it right in the same office. Our surgery center's in the office.
Do you do local anesthesia for certain procedures?
It depends on the procedure. Very rarely do I do that. Certain like blepharoplasty, upper eyes, we can do that under local. Sometimes labiaplasty.
So you do that too?
Okay.
Oh yeah, yeah.
Now I know to send patients to.
Yeah.
I do
love
labia
that.
with fillers.
Do you?
Yeah.
I actually do
That's
fat
probably
grafting.
so
Fat grafting.
painful.
See, that would be longer. It is. For
Well, that's why we don't do it under local for most of
I
the
know.
time.
Knock me
Listen,
the fuck
if
out.
I go south in that area, I'm filling it up.
Yeah, but I'm going night night.
It's actually an incredible field because we can't show it.
Get me a blanket.
Yeah, I typically do it while you're asleep because again
Yeah.
I'm adding a little bit
oh
of
my
lipo.
God.
Yeah.
My friend had it, one of my friends, and she said it was the most painful thing, but she said that
But
she's
what did
never
you
looked
do,
better.
Like the inside or the outside? Like
Both, like the whole thing,
outside
the lip,
lips, I don't
everything,
think
like-
it's gonna
I don't
hurt.
do the internals. Internals
She did the
usually
whole kit and
urologist.
caboodle.
I do the
Into the-
outer appearance, labia minora. We don't want
Right.
anything hanging out, and
No.
it becomes irritating. Women come with legitimate reasons. It's not just
No.
I don't like the
Did
way
you
it
ever
looks.
look at someone and be like, ugh?
Sometimes you have to keep the inner voice in.
I'd be like, oof, girl, I feel bad for you.
Yeah. I mean,
Yeah, and you,
it's not just with
your
labia,
husband's
but
paying, right? Okay, good.
Listen, they get penis enlargement too. I feel bad for the wife.
True, true.
You know what?
Yeah.
I refer those out.
do you really?
Yeah.
I don't know anybody who
Dr.
does that.
Zaraga in
Oh,
Fort
really?
Lauderdale. So I trained with him. So I am trained on penis enlargement. But
Wow.
She is.
Somehow
I
we
prefer-
migrated all the way to this talk.
Yeah. We went from labia to penis
Oh my
filler.
gosh.
Love that
Yeah.
for us. Okay.
But as far as
Typical
labia,
Friday.
like it's true. There's
Yeah,
medical conditions.
there's legitimate
that
reasons
women
it painful.
This is fat.
Exactly.
And it thins out too. So
Exactly.
the patients
It's
that
true.
I've done, is it's painful intercourse for them.
It is.
Actually, I had the youngest patient I did that for was 30 years old, pre-kids,
Wow.
and she got knocked up. She got pregnant shortly after.
It's okay. You can say no though.
Yeah. She
But
was
yeah,
looking
because
young.
She was having painful intercourse. So, and then when we filled it up with hyaluronic acid, it was more pleasant experience for her. So for older women,
woke
and
up
then
to a
it's also
picture.
for appearance purposes. I have a lot
Absolutely.
of younger performers. Is that the
Performers, I have a few of them.
yes,
Yes.
adult
Let's say
entertainment.
performers.
They're in adult
Yeah.
entertainment.
I love
and,
that.
yeah, they know themselves really well,
Yeah.
and
I
it's
mean,
for beauty purposes. So
yeah.
Especially when you're on camera. Like, you have to, you know, you look good. I would be mortified if I had, like, things flapping.
Yeah, exactly.
I'm just saying. What celebrity do you like when people come in and they show you, like, inspo?
yeah.
Oh
Like,
my God.
what's, like, the celebrity that you
tell me
get?
Angelina Jolie.
No, that's done.
Is Kim K still a vibe?
Kim K, it's more Kylie.
It's more
When
Kylie.
Kylie came out and told everybody she got 455s by
Oh, yeah, they were all posting their breast aug
oh my God,
numbers.
everybody wanted 455s, and we had to like, if we could have held a sign up that said stop. Listen, just please. Not everybody needs to be a 455 moderate profile. It depends on what you
As per Kylie.
It depends on what you come in as and what your ultimate goal as. Like implants
Right.
is a total geometry problem. Like when I see anybody for implants, it's all about proportions.
Yes.
We measure the base width, and then we talk about what are you looking for? Like what do you want for your upper pole? What's possible? Show me inspo pics. And yes, we can look at Kylie, but you don't see Kylie naked, so you don't really know what she looks like.
Yeah.
And I try and explain that to women.
And
day
everyone's
in and day
body's
out.
different.
Everybody's body's different. But so nowadays I get Sydney Sweeney actually, who's the bigger side.
Wow.
I get yes.
I
get
agree with that. See, I think she's beautiful.
Yeah,
She looks great, though.
fantastic,
Does.
fantastic.
She does. She looks phenomenal.
so good.
That,
Get it,
but there's
queen.
still like, some that like the extra large look.
Yeah, absolutely.
do.
But I mean, I get that. Emily Ratajkowski is always a good one to go by. And like, you remember she was like naked in the Robin Thicke music video back in
That
the day.
girl.
Yes. And then people don't know the names. I know their names, but like, people, they just show me a picture. I'm like, oh, this person. And then different Instagram, social media people.
Nice.
It's all the gram.
It's all the gram.
Don't you
I get
feel like
it.
it's like the trend is smaller.
It's
Just like what's the other one? Kendall is like supernatural.
it is. It's
Kendall
about,
looks good,
it's about-
though. I think Kendall.
See her
Jenner?
post whenever she was talking about like she never had anything done. I'm like, really? Your lips grow as
You and J-Lo should hang out.
with the olive oil.
Yeah, go hang out in
With
olive oil.
oil, drink.
Yeah.
Don't get Diddy involved, but yes.
Yeah.
We don't want that kind of oil.
no.
No, but the trend is definitely to kind of size down, I think, nowadays.
More of a natural appearance.
You must look at women and be like, I would do that, and that. Do you do that? Because I do that sometimes with hair.
Sometimes I think the more frustrating thing is not, I like to listen to everything and then talk about like what's going to make you look best
And feel your best.
and feel your best. I think the hardest thing is implants, honestly, because you almost have to play psychology. Like, listen, I know your friend has 350s, but on you, they're not going to look the same. And it's very difficult to get them to understand that as the expert, like I take a lot of thought into, and I've done so many about how it's supposed to look geometrically to get you to that point, which your tissue starts with. It's just a lot that goes
There's
into
so
it.
much probably that goes into it.
You really have to just trust the surgeon who does it over and over and shows repeated results, whether it's me or any board certified surgeon.
100%.
You have to go by pictures. And that brings me to my, the biggest topic is like, well, who do they show you? Well, how everything is Photoshopped nowadays.
That's
Everything
exactly.
So we have to have that conversation constantly because
You say that, or you're like, listen, that's not real.
Because I've met so many
Of these people?
OnlyFans and girls that come in
Yes.
that are Instagram, stars. They come in and they don't look anything like they do.
I get that all the
in real-
time. I'm like, who are you
Yeah.
here for your appointment? Oh, I'm sorry. What's your name?
Yes, exactly.
Like, isn't that
Run
crazy
into
though? How
one
like
of your big clients the other day, and I was like, wait, who was that?
yeah, she didn't even recognize her.
I did not recognize.
I was like, oh,
Yeah. And that sometimes gets
That's
my
alarming.
like in my internal mind. I'm like, oh, don't say it kind of thing. Like
I know.
that more so is like,
Will you
really?
say,
You're the
like-
same
like
person?
look at the
Yeah,
chart.
I
You're like,
know.
oh, that's.
I look at my phone. Did you ever see the meme where the guy looks at his wife, who's the model, and he looks back and he's like, and she doesn't look like she's in their hoodie and like on the couch,
Yeah.
and it's
Like
she's
eating like out of
yeah.
it, like,
Are
yeah.
you the same person, kind of thing? Yeah. I mean that factors in a lot. When I go in there and I have to explain to patients like, listen, this is really a photoshopped edited. There are such great editing tools now that women are in
AI.
videos.
yes, AI.
They're in videos that are I mean, I guess they're AI. I don't know how they're done, but like one of my biggest Instagram or OnlyFans girls ever, she like tells me, she's like, this is edited. Even the videos of her, like you would never, you could edit a photo back in our day, but now people are editing videos that make them look more hippie or, have
Wow,
better
that's
sized
wild.
buttocks and stuff, etc. So it's not just a photo, it's literally videos are fake.
That's
No, they-
insane. I
we-
didn't even know you could do that with the
didn't either.
video.
I didn't
All right,
either.
well, you learn something new every day.
I have a patient whose husband is in AI, and she has a business, and
That's
one of them
alarming.
was promoting events, and it looks so glamorous and beautiful. I was like, "What mansion was that?" And it's AI. He
Total AI.
literally created a party,
It's crazy.
and I was like, "Wow, all the women you got in there, it's beautiful and not
All
even
fake.
real."
All fake.
It's like, wow, make me look like a supermodel.
Now we've been using AI. I posted a lot of transitions. So, we have their before photo and then they send me this beautiful photo from the beach or whatever that they send me. And that's typically what my audience and my clientele see on my Instagram. I don't show
so
right
the girls
direct.
on the boat,
Yeah,
stuff on the
exactly.
beach.
So I'll do a transition. We'll use an AI app that'll make it look like a cool transition to boost the Instagram views, because that's what Instagram wants nowadays. They want controversy. They
do.
want all that stuff. So, you do that to
We're
get the
learning.
views, but it's still the true before and the true after are the actual photos, but it'll transition as if she's like lifting her shirt and it looks glamorous and fantastic. And that's all AI.
Yeah, isn't that so
See,
crazy?
I
That's
don't Photoshop my pictures. The only thing I would do is if a
I don't even know how to do it on my body. I mean, I'll do a little face app, like a little kiss too.
kiss you.
That's it.
Same.
That's it. I don't know how to do a body. Like that's wild.
I know we both use.
But
Kiss
kiss
but
too.
oh,
It's
well,
very
it
light.
Depends on the day.
Yeah.
But as far as pictures, the only thing I would do, and I tell my patients the same thing, I will remove the acne. If you want me to make your skin look flawless, I'll do that, but I'm not editing my results because
Sure.
you know
Can't. Yeah.
because there's a
get it.
lot of providers that do.
Yeah.
So
and they
many.
have such false expectations that
Absolutely.
3 syringes can make you look
And it's lighting.
20 years. The lighting too.
Lighting. You
true.
have to keep your consistent lighting.
Consistent
Befores and afters, the lighting should be the same.
And the,
I
and the
agree.
angles the same. So if you have, quarter turn and 90, of course the jaw is going to look better. So, I think the patients are starting to recognize that too. I mean, it's
Yes.
becoming much, much better.
Dr. Google has made being an actual physician more difficult.
More
difficult. Or any provider.
Dr. Chat.
ChatGPT.
Yeah.
Yeah. What's the procedure that like a lot of people regret? Would you say?
Oh yeah, that's a good one.
I think nowadays it's honestly the bigger BBLs that happened
Yeah.
in the early 2000s, like early 2000s.
Can you remove that?
Yes, I do buttock reductions, but then you worry about it sagging. So,
Wow.
think about losing massive weight loss in the GLP-1s. It's the same effect. So
True.
I think
They
people are
become
regretting.
lumpier or
They just become saggier and softer. Now we've come a long way because of the post-op regimen we have with liposuction, which I actually learned most of it here in South Florida. When I trained in the Northeast, like lipo was
where'd you
like
train?
I trained in Philadelphia College of Osteopathic Medicine. So I trained in Philadelphia, a lot of the suburbs of Philadelphia, and when we did lipo anywhere, whether it was when I trained in New York at Sloan Kettering, in any of these places, it was like, oh yeah, we can throw a little lipo on. It was like an add-on, and it really wasn't an art. South Florida really made it an art to me, and then it's like the
Wait,
post-op
what?
care.
Lipo?
Lipo.
I heard it's really
Liposuction.
painful.
It can be, but that's why you need the post-op regimen, the hyperbarics. You're getting lymphatic massages. You're wearing the garments properly. I have my whole garment protocol you have to follow. I have massage therapists from.
You guys have hyperbaric?
That's
in the office?
amazing.
I don't have
refer out?
hyperbaric in the office. I refer that out.
What do you refer to?
I just have my girls. They have a list up at the desk to refer to because I have patients from all over. I mean, not just So
Like that fly in.
that fly in, but also in the local area, whether it be Miami to Port St.
Mm-hmm.
Lucie, I have a ton.
So when you say removal, are you talking about like implant removal or fat?
No,
graft
taking the fat out. I literally
Actually,
lipo the fat out, and so it's liposuction, which is why I guess I should have said that. Yes, we lipo the fat out of the buttocks
Got it.
to make it, but then we want the skin to retract. So we're doing the same modalities that we were doing for lipo anywhere else on the body. We're telling them, go get your butt massaged, go wear you have to wear the garments to help the skin retract down.
Makes
And
sense.
the results are pretty good. I mean, honestly.
That's
What about,
great.
Like, whenever the silicone became so big for the lips, for the permanent,
Yeah.
do you see
Oh my
that
God,
a
I
lot? 'Cause
remember that.
now
No one does that
was
really.
One of the and I know I'm not in the plastic surgery arena, but I get patients that still have, and I won't touch them.
Yeah, the
'Cause,
silicone implants.
granulomas and everything. So I have
Yeah.
implants and silicone
injectables.
injections.
I took injectables out.
Like Belafil that they or whatever that was on the market.
I was taking it out mostly patients from South America, though. I didn't have too many from the States that had the silicone injected in their lips.
I know there's somebody in Aventura and there's somebody in Boca. They specialize in removing the lips, and it's like $17,000 procedure.
Wow. I got to
And then you
more
got
for my
nothing.
stuff.
Come see me after.
That's such a, it's
have,
actually
like,
a pretty
nothing.
easy procedure. I mean,
Really?
I've done it, and like it's easy results because your scars can easily hide in the.
But then they got nothing left. You
Well,
remove all the tissue.
You remove, you don't have to. You remove, you pluck it out. The silicone stays together. It's like it's foreign body. You're like literally popping it out and you're getting it out. And you cut the scar tissue out. Sometimes there's some granulomas like that.
Yeah.
But it's not really that difficult.
Did you always know you wanted to be a plastic surgeon? Like, how did you know? Because my daughter wants to be one.
I came to the realization twofold. I always wanted to be a surgeon. So
Okay.
I did always
So
want
you
to be a
knew that.
surgeon. I used to want to do cardiothoracic surgery. But I shadowed it right after college and before I started, while I was doing research. And it was going the way of the dodo bird. It was like they were going endovascular. They wanted to start doing things through the groin, less invasive, which is
Right.
great, fantastic. And they were doing less open heart bypasses and stuff. And honestly, the environment in the OR was kind of malignant. So I was like, well, I still want to be a surgeon. And then actually, moms know best. My mom was like, you should be,
They do.
you know,
We just do.
yeah, I know. Moms know best. So
Yep.
so my mom was like, I guess she was watching Dr. Phil. Not maybe it's Dr. Phil. I'm probably before Dr. Phil. I think it was probably Sally Jesse or Raphael or somebody like really old. But anyway, plastic surgery was like a talk. And she's like, you should do plastic surgery because I was always in gifted and talented art.
Oh, that's good too.
I was
then.
an artist. I still play guitar when I can. Like I always use my hands, and I wanted to be in a surgical field where I could use my hands forever and use a little bit of that artistic skill because I like to see symmetry. So it just kind of evolved, and then Nip Tuck came out, and I was like, yeah, I think I want to do plastic surgery.
Wow.
And then plastic surgery is on another level now.
Yeah,
It blew up. It's
exploded.
It's so you got into the right field.
Yeah, it really has. It has.
You still love
So
it?
you love what you
I
do.
do love doing surgery. When you go into medical school, they don't tell you all the business that goes into it, even that you're going to be on a podcast someday trying to, we don't, I
know.
didn't train to do a podcast.
Oh, by the way,
they don't
you're
teach you anything about marketing,
No.
business, running a business. I mean, I'm really 10% surgeon, 90% have to build the business, maintain the business.
Amen.
Amen.
It's very hard.
Amen.
24/7 job.
is-
Like I
it's
No
think
days
Mosca
off.
and I,
No days off.
yeah,
Same.
we have
Which
we-
residency
Besides
prepared me
this,
for?
I have the salon. She has her med spa. So it's like, we have kids.
When you have entrepreneurial aspects,
Yes.
it's very hard to actually be the surgeon. I wish there was more time to be a surgeon. So the only the 6 hours a day I'm in the OR, we can't be on our phones, which is fantastic. And
Love that for us.
Totally sterile. You can't. You just you get to focus. So I
you
do
get to
love.
almost zone out.
Yes, I love to be in the OR doing surgery, and I think every surgeon. There's a lot of plastic surgeons, I think, who went into plastic surgery to be called a plastic surgeon. And then
Yes.
there's plastic surgeons who went in because they're just technically good at surgery.
100%.
Yes.
And I
agree.
like to think that I'm technically good at surgery, and I love doing it for that reason.
That's
And
amazing.
you have the eye for it because I feel like it's the same thing with injectables.
Yes.
As well. If you're not an artist and you're just doing it for the money, it doesn't work. And to your
And people
point,
can tell. Your belly button's on your ass.
I just also feel, now being on the medical side and a business owner, I have no idea how I would have made it if I didn't have the background of a rep and business. I don't
Absolutely.
know how medical professionals do it. So I give you all the credit in the world because you're
You
so
you guys
trained in
have help,
medicine.
right, with the business though?
I mean, I'm on my own. I'm doing myself when you know that. I'm on the phone with you all day.
I know.
My husband literally told me today, she's like, I haven't seen you in so long. And I'm like, I haven't seen me in so long either.
And then he's like, tonight will be a great date night. She's like, I'll send you a selfie of me and Marissa.
Yeah.
I'm
yeah.
like,
yes. It's
I feel like Marissa and I
we're
are,
more like in a relationship at this point. We're like work wives, not in a weird way.
no. I didn't insinuate that at all. But no, yes, you have to dedicate your life to building your business while you're building the business.
Yeah, it's so hard.
You have to understand the dynamics of what patients want, what they need, and also how to market in today's world of
How to handle
AI.
crazies.
Yeah, all the crazies. The AI, the Instagram, and it's so
Absolutely.
big. If you're not on Instagram, if you're not doing content every day, and it's exhausting.
It is
and
exhausting.
I'm like, I just
a whole
wanna
other job.
Inject. I want to do my thing, and why can't
can't.
you just find me?
There's no yellow pages anymore. You have to like,
Exactly.
yeah, the world is a lot smaller.
And
It's
people
good and
don't
bad.
Look for before and afters as much. They do, but they don't.
Yeah.
You know, they want to know they feel like they know your personality when they arrive based on your Instagram.
Do you post any of your personal life, or do you try and stay away from that?
I stay away as much as I can.
Yeah, me too.
But a
You
little
do.
bit. Like,
I've
I'll
been
put a
doing more
drop.
personal lately, and you know what's funny is I feel like people engage more with that.
They do.
They do.
They do,
They
but
want to know you.
I have
but
resisted it for 10 years.
I try to like keep it at a
Yeah.
minimum,
I
but I
give a
do like to
glimpse.
show a little bit side of myself,
Yeah.
so they feel like they
recently
comfortable.
started because I was getting a lot of questions if I'm still married.
Well, yeah.
Like, well, yeah, here's the husband, here's the kid. I actually have 2 kids,
Yeah.
But so I dropped a couple on my story, or like when my daughter just got into FSU, I did a little
congratulations.
thing,
Which is awesome.
So awesome.
Go girl.
I'm having a hard time with it. I am. I'm like my baby girl.
Don't even talk to me about it.
Day, and she's off to college.
I'm 5 years old.
right.
Still,
It's crazy. It's so
know.
crazy.
it is. It goes fast.
So I did a little bit of personal there, but I tried to really.
Yeah, I like to do it a little bit on
little
stories
bit.
every once in
A
a
little
while.
bit.
This is it.
You know, because
Same.
people like
I don't
memorize your stuff. They'll come in and talk to you about it. They like
Yeah.
memorize.
I
your
know.
stuff.
I don't post like my children,
Yeah, I
but
don't
again,
post
I'll do a
anything. Yeah,
story.
Story.
Yes.
Story. 24 hours, it's gone, and you can delete
Yeah.
it if you want. So
Yeah, exactly.
I always try and put my daughter on, and then my wife
How
is
old is
like,
your
"Oh,
daughter?"
you're trying to like promote your daughter so the girls will like your daughter." I'm like, no, but she's 11, and she's
Okay.
she's
You
pretty
have
much
one?
grown up in South Florida. Just one daughter.
Okay.
Yeah, she's already looking forward to be my front desk girl. So she's like, she comes to the office. She's like, I can't wait to work here. I'm like, oh, that's so sweet,
That is
but I don't want you here.
Yeah.
Well, you know what? They all say that. My daughter said the same thing.
Yep.
And she may have come in to help 3 times.
Yeah, I figure
She
it's
does
gonna be
content,
something.
but
She does help with content.
she does.
Yes.
She's really good. She
She's
helped
good with
both
that.
of us. She made this. for
Yep.
us.
Thanks, girl. She made our
made it.
logo.
She made my logo for my business.
She made our logo.
That's important stuff.
That's what I'm saying.
matters.
So
Because we
she's
can't do that stuff.
Yeah.
We're
and they're younger. They're in high school, so they like
come
love
up
it.
with
They
some
know it.
content for
Yeah.
us.
It's
I'm
like
like,
nothing.
that's great.
Yeah.
They have these little things that follow them with the phones and
Yeah.
such.
It's
You know, like
insane.
it tracks them.
So
while
your
they're
daughter's
walking.
probably so into
She's
skincare.
so good at all.
And
I mean,
don't they love like the bubble, all that stupid skincare
I
shit?
try to keep her away from all the.
They love like skincare. Today
yeah,
it's like a
yeah, yeah.
trend.
Yeah.
Like all my daughters, they like have the vanity with the skincare, and it's like a whole thing. Then Sol de Janeiro.
She's trying to get
sprays.
into all this stuff, and so my wife keeps it hidden from me. Like
Yes.
she like orders it from I see
I
it,
know.
I see this stuff show up, and it's like, why
I do
are
the
you
same.
wearing makeup? Where did it come from? What are you doing? Like
Yeah,
that's
it's so cute.
daddy's girl kind of thing.
Totally, that's good. I love that.
But how does your wife feel about social media?
I
He
mean,
doesn't want to be on it.
she doesn't want to be on it, and it has dictated my life for 10 years. It's been hard because
Yeah.
I mean, patients. What built my business is not just being on social media, but it's the fact that patients have always reached out to me on social media. So I've been on call for 10 years, 24/7. Like I'm sorry it's the weekend. I'm sorry you're on vacation, it's nonstop. And I'm
But-
so OCD that I don't let work build up. I see it as work and I have to address
answer
it.
right away.
And I answer right away. So
Yeah.
it's been a nonstop battle since I started. So, it's tough being married to a plastic surgeon in the first place, but then having to deal with it constantly, always.
Mm-hmm.
And, you have the girls that send you pictures constantly that you're going to post. So it's a tough field. I give her a lot of credit.
Yeah, I give her a lot of credit too.
It's tough.
I feel like our husbands were kind of on the same page. Like, you don't post enough with us, and then we post with them. Like, I don't want to be in your post.
Yeah, I know.
Yeah,
I'm
my
like,
husband's I don't want to be in this anymore.
okay. Yeah.
I mean,
It's like the balance.
they want to be in it every once in a while.
once in a while.
Once in a while. I think it's nice. But yeah,
Oh my gosh, my son would never. He's like, I'm gonna get bullied because I see all your stuff. You do that butt stuff.
You do the fun stuff.
Well, yeah, I mean, at some
I
point,
love that.
Friends follow me, and you know, like I post labias and I post BBLs, and then I post funny content. And Marissa
We
and I
do. We do stupid stuff
we do
sometimes,
stupid
but
stuff,
it's
and we're
funny.
still
good, though. It's
moms,
good.
you
all
know?
Yeah, it's
in
still
good
moms.
humor.
Yeah.
even being a mom is, I mean, just listening to you two, it's really evolved in the past, you figure 10, 20 years. So that's why I think
gosh,
plastic
yeah.
surgery has evolved, because everything is just more kind of like open, and you're just more, you just seem younger than moms did 30
Oh,
years ago.
wow.
I
You know what I'm
agree.
saying? Like,
I
just
agree.
overall, the mentality is different.
I feel
Yes.
like that also it's like the working out part of it. Like women
Yes.
are now getting back into the gym. Before it wasn't
100%.
a thing, you know.
Mom, my mom didn't work out. Did moms work out? Like they just cooked and stuff.
No,
like,
they just took care of the house.
that's it. That's all you
They
did.
made the home.
They made the home,
Which is fine,
and-
but I have
but
a bigger
it's all about the
plan.
balance too. And
Yes,
I feel
it's-
like
it's gotta be
you know,
balanced.
I
Yes,
think
I
it's
agree.
amazing if you have an opportunity to be a home mom and you have the patience for it and the skill set. But it's also, you know, I did that for maybe 6 months, and that's all I could do.
I did it for a year, and I was like, no. You just start going like the every day. It's just the same thing
I become
every
a
day.
clingy wife.
Yeah, I'm like, when
And
are
then
you?
like
Me
a
too,
helicopter.
yeah.
My husband
Helicopter
at one point
mom.
said, "Like, I wish you were a helicopter. You're like a mosquito. You're like up in here."
I love
So
it.
I'm better, you know, being productive. You know, I feel like that's more balanced for me. You know, you have to have something outside
Absolutely.
the house.
You have to.
And the kids also appreciate that. Like it gets them involved. They get chores. You know, so for us it worked out. But you know, there's better house moms out there that get their kids to do chores. When I was home, I'm like, I'll do your laundry. I'll wash the floors. I'm so bored. Let me like wash the floors again.
Yeah.
In Boca, this happens. I mean, I feel like everybody's got their nanny doing all this stuff now.
That is-
it's hard.
yeah, well,
At least my,
True
it's,
that.
it's,
Yeah,
it's,
that
it's,
is true. I didn't think of that.
Everybody does. They're like literally revolving
Well, but
nannies.
know.
I live in Davie, so I'm not in Boca.
Oh, I'm in
Davie,
Boca.
you do it yourself.
In Davie, you do it yourself. Boca, you have a nanny.
But you have Southwest Ranches right by you. I mean, that's just like
Yeah,
Davie,
seriously.
I'm kidding, Davie.
You're in a
it's
nice
swanky.
area.
It's like
I
the
am,
swanky.
like you said, OCD. I'm like, wait, you missed this spot. I'll
I
do
know.
it myself.
It drives you
I
nuts,
know.
doesn't it?
Yes, and if my
does.
house doesn't smell a certain way, like you cannot fart in my house. The candles are lit up, and
You're not allowed to even
Yeah.
go number 2. It's forbidden. Leave. Go down the block to the
I
Dunkin'.
think it's an aesthetics thing. I drive my wife, I drive my
it has to
family
smell
nuts
a
because it
certain
has
way.
to look, it has to be like,
Yes.
she's like, you want the house to be a museum all the time. I was like, I just like it to look a certain way so that when I come home, my anxiety doesn't also take over, that I have to like have this.
Dust. Yes.
Yes.
Yeah.
For me, it's
I
the
feel
same.
you
It's
on
like,
that.
It has to smell good. I have to get that like vibe to be, you know, it's comfortable and cozy and clean. Like I can, if there's dishes, oof,
I know.
I can't
the
do it.
counter.
Don't even get me
missing.
started. Don't get me started on that. Like,
Maybe it's like the aesthetic world.
I think it's
and
just,
Yeah,
we
I
just
think
like
'cause
things
we're
to
very-
look proper and primp and
certain way,
perfect. Like,
100%.
it's all the same.
Yeah.
It's all the
I
same.
mean,
What do you think's the biggest misconception like about plastic surgery?
I don't know. Nowadays,
Because I feel like it's so common.
it's so common that the biggest misconception is that it's either all bad or all good.
Right.
You know, there's like there's no in between, and you
Yeah,
really,
people be like, I never would do that. And then people are like, I'm obsessed.
yeah, everything is so polarizing nowadays that it's like it's just all bad or all good. And I think the misconception is that, for some people, for most people, it should be used as an adjunct. It's not going to change your life. You're not going to come in. It's not, we're physicians, not magicians, but like you're not going to come
True.
in and leave as you want. It's not how it works. You got to put the effort in. I had a patient, one of my best patients, she came in, referred to me from a very high, kind of like marketing agency that refers affluent patients to the quality surgeons around the country.
Right.
This exists. And she came to me, and afterwards we did a mommy makeover, big case, and she actually was interviewed by People magazine because people do think that it's like you just come in and get surgery and you're great, especially the celebrity.
It's a mental
clientele.
thing,
It's a mental
too.
thing. It's mental, and then they go through buyer's remorse because they don't understand. Well, I'm making you sit around the house. You can't lift anything. You can't exercise. There's no baths. You got to take a quick shower. You're in garments. You're restricted. You can't lift. It's
Can't drive.
can't
Yeah,
drive.
yeah.
So you go through like a buyer's remorse. And it takes time. So People magazine was interviewing her because she felt like this, but she's so happy because she went back to the gym and stuff and made it an adjunct. And now 3 months out, I mean, she loves me. She's fantastic, patient. And I think that is the biggest misconception, is that you're just going to come in and get surgery and you look great the next day. That's not how it is.
It's
at
a
all.
process.
Because the generations, as this generation becomes more and more dependent on their phone and immediate gratification, whether it's Chat GPT, AI, they think that surgery has evolved to the point that it's immediate gratification, and it's not. You have to heal the proper way.
And you know,
100%.
AI. So I was reading that the biggest thing now is AI comes up with plastic surgery plan
Ideas.
for you, ideas like what your body should look like. How realistic is that?
I mean,
You know how many people come in with hair AI pictures and they're like, this is me with brown AI hair. I'm like, that doesn't even look like your face. Like,
it's similar. It's really similar.
is that like what?
I mean, it's totally similar to that. You just
I can't lie, but I can't make your waist.
you can't make
23.
people fake certain way. So like,
Right.
you know, that's part of it, and you have to just explain it to them. And I don't mind having those conversations. And you win some, you lose some. Some people are just like, no, I think I can do this. And okay, I'm not going to be that guy that tries to do it and you're unhappy with it though. Because it's like being a psychologist with a knife.
100%. Yeah. Oh my God.
I
You're a
feel like sometimes-
therapist.
A lot of the time, we're therapists.
Yeah.
Well, you have them in there for like 6 hours. You get all of
At
it.
least yours are sleeping.
It takes a lot to get them to go to sleep.
I know.
I got to talk to them a lot about, I
True.
got to go
You
through a
got-
lot of talk.
So you
before I-
talk a lot before,
And
then they
after.
sleep, and then they go after.
And
Yeah.
then it's the after, and it's like, oh, this is a little bit off by like 1 millimeter. I'm like, oh my God.
Oh my god!
You're like, you're actually batshit crazy. You're welcome. Leave.
the best you'll ever look.
Yeah.
But yeah, no, I
But
feel like
no.
I'm a therapist a lot, and
Yeah.
a lot of the time it gets into the, you know, their personal life. Like
Yes.
the patients become your family. They literally do. You know more about them than
Most.
than
Then I
their
try to.
immediate.
You're like, I don't even want to know
I don't
that.
want to know the details. Wait, are we out of time? Oh.
Time flies when you're having fun.
When you're getting all the topics you want to cover.
Time flies.
I love it.
No, this was great.
This was awesome. We
Thank
definitely
you.
can't wait
We're
to have
gonna
you
have to have you
back.
Yeah, you guys can have me on. Like I was telling Diana, like I don't know, a couple times a year, few times a year for like stuff. I love doing this stuff.
Yeah, it's
No, that would be
awesome.
ama-
Because
'cause
so
I
many
feel like we'll
people are
have
going to have so
different
many
topics.
questions.
Yeah.
Then we could go into
We can go into topics,
Right.
and if you have somebody on, like, and I can refer you the face guy. I'll tell Mascaro about this, like, and you know, once he sees it, etc. So he's like the bigger face guy here.
Yeah, he did my aunt's face.
He's fantastic.
She looks
You know what?
amazing. All right, well, guys, thank you so much for Glow and Tell today. We loved having Dr. Kevin on. So he's going to tell you where he's located. And if you're interested in getting any plastic surgery done, he's Dr. Boca Raton.
Yeah, so it's pretty simple. My business card is Dr. Boca Raton. Instagram.
I love it.
You know, it's not really hard to find. And then I'm located in Boca del Rey off Federal Highway. Great location, very easy to access with the big sign, looks like the logo. And you can find all the information, make consultation requests or anything actually through Instagram or the website,
Amazing.
He is
drbocaраton.com.
amazing. I've seen
He is.
his work and I've heard so much about you. Well, I've known you for a while, but I've also had such amazing feedback from patients.
I really appreciate you ladies having me on, especially for one of these premiere episodes, you know, the prime time.
Prime time.
You're amazing. Thank you so much.
Yes,
for
thank
all
you
the
for coming on.
information.
Appreciate
My
it.
pleasure, my pleasure.
So make sure you guys subscribe and follow us on all social media platforms. And we can't wait to see you on our next episode. So stay tuned.
Thank you so much for
Thank
working
you, Glow and Tell.